Good morning, Namaskar. This is Engineer Suraj Singh speaking from Bharat, India on this day of January 8th, 2021. 7 days have gone of 2021 and we are using this title. Title today is Bharat India, an analytical informative talk of COVID-19 plus variant status for January 7th, 2021, reported on January 8th, 2021, that's today. Government of India provided data based worked out spreadsheet files screen share for national awareness for Government of India has been sleeping. What to say? I can't answer. Really. You can see this graph and you can say 314 days since March 1st, 2020. No change in our attitude towards towards running fast, towards increasing pace of controlling COVID-19, and we do not want to do something really unfortunate it is. As I said already, only way is plan, only way is schedule, how to chart out three lines. One is testing, one is treatment, and one is post-discharge controls. These 3 points are important, but we are not moving on any of these except some kind of misconception about forthcoming vaccines, which are not relevant to treatment of COVID but just to increase level of body immunity, which you can raise otherwise as well. What to say, what not to say, I have no answer. I cannot say, only I can just go to next page to announce yesterday's statistics that happened in our country before further moving on to current talk and status of COVID in our country. We are really very, very, you can say, ignorant people. Here I say total cases as recorded in our country in various states. Then active discharge and deaths, we'll consider this point only. So we have to announce this first. You know it, but I'm just copying it. This all, you can say this portion is copied from ministry website. This portion. Other portions are worked out. This is not ministry's portion, and this is not ministry's portion, and this is ministry claim here. What claim they say, we'll talk of this. Every day they claim, and this claim is futile or fertile or valid or invalid. You have to decide. So this is status of 7th of January, 721, reported today on January 8th. And that's here, you can say Maharashtra 19.58282 lakhs, Karnataka 9.24898 lakhs, Andhra Pradesh 8.84171 lakhs, Tamil Nadu 8.23986 lakhs, Kerala 7.95933 lakhs, Delhi 6.28838 lakhs, Uttar Pradesh 5.90844 lakhs, West Bengal 5.58173 lakhs, Odisha 3.31151 lakhs, Rajasthan 3.11620 lakhs, Telangana 2.89135 lakhs, Chhattisgarh 2.86596 lakhs, Haryana 2.64161 lakhs, Bihar 2.5447 lakhs, Gujarat 2.49913 lakhs, Madhya Pradesh 2.46822 lakhs, and Assam 2.16481 lakhs, Punjab 187 lakhs, Jammu and Kashmir 1.22176 lakhs, Jharkhand 1.162229 lakhs, Uttarakhand 92,842, Himachal Pradesh 56,146, Goa 51,626, and Pondicherry 3,836, and Tripura 332, Manipur 2,853, Chandigarh 2014, Arunachal Pradesh 167, Meghalaya 1353, Nagaland 119, Ladakh 960, Sikkim 596, Andaman and Nicobar 49, Mizoram 42, Dadra and Nagar 3, and Lakshadweep 0. These are only statistics, and they say total cases so far. Total case so far 17 crore 93 lakhs 36,364, 17 crore 93 लाख 36,364 लोगों का अब तक टेस्ट हुआ। अब तक लोगों का टेस्ट हुआ अब तक। और ये आपके केस 1 crore 41 lakh 1 crore 4 lakh 13,417, 1 crore 41 लाख 1 करोड़ 4 लाख 13,417, 1 करोड़ 4 लाख 13,417 अभी तक पॉजिटिव पेशेंट्स मिले। This is what she says. All right, now what is required, as I said in my posting everywhere, we have to contain this. Contain means we have to crush this. You can say we have to deal with this. We have to defeat this. This is called contain. Or you may say defeat it, You may say defeat it in your language. It's easy language. Let's say we have to defeat this. Is that easy? Point is that. Is that so easy? If it's so easy, why we not defeat it so far? Defeat is also a question here. We have neither defeated nor contained. We can say, are we failed? Yes, we can say we have failed. We have failed. We can say we have failed here. All these red lines. We have failed tremendously. Why have we failed? Because we have three scenarios here. One, control 1, second, control 2, third, control 3. Testing, not done, partly done, very partly. Control statement, not cared about. Cared only on private hospitals, you pay, otherwise government hospitals, no infrastructure. Discharge cases handling, no record. No infrastructure, and what about this? Nobody knows. These 3 points must be clear. Where do we stand in testing? These 3 points are very important. Where do we stand on these positions? Do we stand somewhere? Testing, treatment, discharge, cases handling. We don't know about this. Why don't we know about this? Because we have no system, we have no formula, we have no approach, we have no initiative, we have no proaction. In fact, you can say some of all these is that we are ignorant, we have condoned this, we have overlooked this, and we are not thought of, we are not contemplated of this. Every day you think on this, you will find more and more natural input to you. That's what we say. These are very clearly speaking, these you can say matrix. This matrix is clearly speaking something which you will come and see what to do, what not to do. Now, this 1.2, they are managing, keep it constant, this is that. It's not changing. I was reading this for many days. They want to keep it 1.2. I think this is they have decided. And this also approximately yesterday it was yesterday 1.9, 9 to 4 points. So it is just, it's almost same. And this was 3.1 yesterday. and today it is 3.08, almost same. So this chart is also almost same, no major change in this. We cannot interpret every day, 1.2% is here, this is 1.2%. And if we apply this to whole population, though it's not applied because they have tested only 13.795% people. And on that account, on that basis, and untested 86.2.5, on this basis 13.795, report says that they have resulted in this. If we apply that to one to whole population, not only to small population of 13 point something, it comes out to 1.56 crores. That is what the statistical answer is. And this would increase every 3 months, Every 3 months means 3 months means a period of 0.25 years. So we can take a factor of 1.25 every quarter, and that's what we have done here. These all factors are additional 25%. The previous one, these factors are, and this is increase in that's increase 1.56 to this 1.95 to 2.44, 3.05, 3.82, 4.77, 5.96, 7.45, 9.3 crores. And this is graph which is speaking a lot. Population, you can say. Then you can say gross death. You can say this is 9.32. These deaths, right, time period, and that's why I say 25 here is time period. Time period is this is that, and this is population. This is multiple graph. And we go to only death graph, and that is this one, time period, and this is number of deaths, crores, in crores. This is the one. And we are saying, what we are saying is very interesting. We are saying, let us say, India is taking all necessary steps to ensure that we are prepared well to face challenge and threat posed by growing pandemic of COVID-19, coronavirus. With active support people of India, we have been able to contain the spread of virus in our country. Most important factor, spread virus. Most important factor preventing spread of virus locally is to empower citizens with right permission, taking precautions as per advisories being issued by Ministry of Health and Family Welfare. This is just a statement, meaningless statement, no weight in this. According to my observation, according to my assessment, this does not carry any meaning, just a formality, it is nothing else. I don't call it claim, it's rubbish, you can say, because they are not doing anything. Well, now coming back to this here, and further, this is based on our report, and that report is what is based on this page, sheet 1, we go here now. Before going on further, I would say this again. I reference I say these five, this one, this one, this one, and this one. These 5 columns have been taken or daily taken from government website. There's nothing added by me on these columns. True copy, you can go and check. You don't find any, you will not try anything but only one day data, and that is this one, yesterday's data. This says date since March 2020, and today is 314 days, population, percentage of test per population, and this is here, you can say this is total number of tests done. Total number of tests done, and which is 13.75 percentages, 795 percentages, and this is percentage of those not tested, that is 86.205, you can say. This is here number of tests conducted yesterday, number of tests, that's 935,369, lesser than this, and there is a 21% drop in this. You can say 21% drop in 1 week. 21% drop in 1 week means there is no care, no concern, no seriousness. How many have come, they test, and that's it, nothing else. No, no approach, no roadmap, nothing. I can simply say there's no roadmap how to how to apply test to all citizens because they cared only this voluntary thing. This 13.795% out of 100, so many people can go to hospital or private hospitals or called laboratories, and this is blank here. These people are blank, no test done on them. This is number of tests conducted yesterday, I says, and this is number of patients discovered till now or detected till now, and that is 1 crore 4 lakh 13,417 out of this percentages. So many are now. This is here 18139, which is number of deaths they projected yesterday. No, sorry, not that's number of patients yesterday. I'm sorry. Number of patients, COVID patients they registered yesterday, which is a drop. They're trying to show a drop here. This is what policy is. Just keep it down so that people all over the world who say Bharat is performing very well and their cases have come down. But nobody would focus on this percentage. These cases relate to this percentage of this population of patients. This and this and this are related, and this is number of updated deaths. 150,517 deaths have affected till now. This is what is statistics of yesterday. And we have to be very careful here that this number here is how many people have been tested out of this. This number here, this tested, this number here, this tested. So I try to convert to percentage wise, and that is here, 4 days. You can see here 4 days, and this is average, and this is total population here. For example, 1.83 here. This is, you can say 1.83 M112. This row, in this row, these two out of this tested and this patients. So 1.83% patient, 1.94% patient, 2.17% patient, 1.94% patient in these 4 days. You can see also 16375 and this is 896 something like this. These percentages are for 4 days, continuous 4 days, which gives an average value of 1.97. We can take previous also, but I don't have that space here, so you can, if you wish, you can take yourself and check it. It's not a big deal, you can check it, or we can say you have to find, we can use more cells here, but it will remove this noting. So we take 1.97, let's consider only 4 days, 1.97% average. And if you apply this to whole population, let's say whole population is tested 1 day, then 2.56 crores patients. So it's big one. If 1 day you are getting this value. So I think you understand now what I mean, and what today I reported is, let me go and read that first for you, because that's also very, very important point before going further. I'm speaking from my posting. You can read that. It's available on video. If not, you are not able to read now, later you can read that. And it's there. Government of India claim, as I explained to you, I need not repeat that government of India claim, written already on your Excel, that's graphics and your graphics. And then there are posts, URL of posts done every day. These are about 34 URLs. The videos, about 47 URLs are there. I'll add today's because it's not available yet. So it says that COVID-19 strain variant report updated today, that's 8th January 21 forenoon. Public must think very seriously about how to achieve loss prevention or risk prevention by application of required pertinent measures in relation to COVID-19 plus explosion, because nothing is being seriously done by our nation. This is no loss prevention method. Incoming vaccines shall not impart any recovery, treatment, solution, or regular protection, but only immunity augmenter. Augment means to raise it, multiply. Okay, so add to that one. That's called augmentation. Collection of your products also augment, immunity level. Building bylaws, building always, any building or structure or whatever item you can say, remains, you can say, prone to fire, but if loss prevention methods are applied, loss to life and property can be minimized. So this also applies to COVID-19 plus. When I say plus, it is variant, it is a strain, etc., etc. Possible magnitude of risk must be understood, evaluated by analyzing its power, and then based on analysis, practical applicable solutions must be searched and finalized prior to it's too late. COVID-19 strain variant has already spread in many countries, name Bharat, Canada, UK, Australia, etc., European areas, Germany, France, Italy, Singapore, Hong Kong, Sweden, Jordan, and many more. Bharat India had crossed, I can say, more than 1.035 crores COVID-19 cases many days back, and also many cases of variant strain have been reported from various parts in our country. Individuals out of 130 crores, only 17.93% have been considered till now for test. That is 17.93 crores. Now, percentage wise, it is 13.795. And those, it is in 314 days, it's a shame on us. In 314 days, we could perform only 13.795% work, which is shame really. And 86% have been left. They have not been tested. And we don't worry for even COVID-19 strain plus government of people of Bharat has mostly people of ours have become sheer careless, irresponsible, and ignorant. No plan is available for remaining 86.205% population who have been remaining untested, which has made it impossible to fix certain required milestones and schedule out past prospective time scale based plan to combat COVID-19 impacts. It's a must to have a concrete scheduled plan to control COVID-19 plus, just to avoid its powerful explosion that could cost crores lives directly and many crores additionally infected. Now, testing speed has been non-conducive, extremely unsatisfactory, every day I call it, or I would say uh, not extremely, outstandingly unsatisfactory, which means no plan can be charted out at present state. Requirement of testing plans, treatment plans, and post-discharge plans are not available, as must be professionally required, which missing details clearly indicate that we are a sleeping nation. Real state of future of COVID-19 in Bharat, India cannot be correctly either forecast or predicted analytically. In this connection, I had sent mails to government many days back, many weeks back, with URLs which I include here as well, but no response from government, just acknowledgement, that's also by computer system. There is no response post back. They just refer to see our website and that's all. Never expect a government to high degree responsible. They are responsible. No change or acceleration program is visible. No projection of any program is available. In fact, testing speed has been still really outstandingly unsatisfactory, whereas government has always tried to reflect this number of positive cases by manipulation of data. No reported indications seem to be on part of government to an extent testing a whole population is concerned. In case of no right reliable data, no projections can be reflected. Government doesn't take any responsibility for testing of common citizen. It's assumed to be responsibility of citizen to have a test done if one feels it's affected by COVID-19. Government has distanced itself from owning public health responsibility. Now, total tests conducted, you have this here on up to 7th January 2021, 17 crore 93 lakhs 36,364. Tests conducted on 7th January 2020 itself, 9 lakhs 35,369, which is much lower than requirement. Requirement is 65 lakhs to 1 and a quarter lakhs per day, quarter crores per day. 60 lakhs to double of that. Total corona infection till 7 January 2021 is 1 crore 4 lakh 13,417, which is manipulated figure, I can say. Positive cases declared 7 January 21, 18,139. This is also manipulated, and this is control point where government claims something. Death update till 7 January 2021 is 1,50,570 or 150,570. Population tested is 13.79 thousand only, as I told, since March 2020, and remaining 86% without test. Time required whole population 1284 to 1106 days, and these are not admissible in public. I am sure public will not accept this point. Why is government not serious? I cannot say. Why is government not improving? I cannot say. Government has actually ignored poor people of this country. Why they are sleeping? I can't answer. Unknown worryless state of public. No welfare state now. Government doesn't look anxious to test all citizens. It's very, very slow testing. Why do people of our country suffer for none of their faults? Only sufferers are poor people living at lowest rung of society. And shall we allow such unbecoming state of lack of public COVID-19 testing? Why are suffering people not raising their voices? I can't answer. Maybe they are scared or they don't take care of this. They don't know what is health, what's the value of health and life. They are not slaves, but they have been converted to be slaves, as they cannot speak against Modi's regime. Why is government left runs the responsibility down to people themselves? That's another question. Where are funds going? Funds were collected for public welfare of COVID-19. Where the funds are gone? There's no question. Seems all people shall not be tested because till now there's no policy. And that's unfortunate. Really speaking, there is just no government policy towards public handling of COVID-19 strain plus. Have tested yourself if you want to and spend money, 12,000 to 2,400 for test each time. Conduct your own test. And after testing is over, and if you are detected positive, pay for your treatment along with medical assistance cost, which is 1,500 to 3,000 per day, along with expenses of attendant, food, boarding and lodging, which you have to afford, and all PPEs, injection, medicine, oxygen, ventilator, whatever. If you stay in hospital, you have to pay 10,000 to 20,000 per bed and all other expenses. And you have to keep lakhs of rupees with you if you want to be admitted to hospital. You have to decide yourself. No one is responsible for you. It's an explosion. It's a medical explosion, health explosion. It's you can say it's a carpet bombing like that. Carpet bombing, health carpet bombing. And we can say, come what may. Due to inefficiency and sleeping attitude of government, lethargic public COVID-19 shall certainly explode in our country, and nuclear fission of COVID-19 would occur. A nation that deals like this must face that type of problem, and a society that remains non-serious on top of that sleeping have to face such adverse results for sure and for certain. A nation that cannot think to resolve its problems seriously, such results are possible. Nation cannot wait for many years, and out of my understanding, 1.3 billion people, including many crores intellectuals, but their lips are strict, tightly, perfectly. They have no courage to speak. If you don't speak for necessary action, because government is totally lethargic, you are going to face everything. You have seen what's happening in UK, what's happening in European countries, what's happening in America, elsewhere. Think for nation, that's only aim, nothing else. If you cannot think for, you cannot do anything. That's also true. So here I say, very serious issue. We should not take it lightly, but we are taking lightly so far. Well, You can see, again I show you this laughing graph and everything, and still I can say if this takes whatever is happening now, this continues, you require only 1106 days for testing. If this speed continues, because yesterday we tested 9,35,369, and average per day according to so far whole number of days is 330 minutes. 5.71 lakhs only we tested each day. That is really worrisome. And only 17.93 crore people, and we can say this is really a very, very serious issue, and we have to be very serious about this. What should be done? Because we have to resolve this. What we have to say here, let us say our understanding is, our commenting is, let us say this. No doubt we are sleeping society. No doubt we are sleeping people. No doubt we are sleeping government. We are drastic failure. And we are not interested. The government is not interested in anything. No policy exists. No actions do exist. No seriousness exists. That's what we are. All these points are reality based, no fiction. Keeping abreast what's happening, these are not fictions. These are realities, you can say. And then, can you wait for so many number of days? You have to decide this. Because rather, we should test 90 lakhs per day. We are testing only 9 lakh per day. That is also not regular. Drop and drop. And 1106 days means 303 years you have to wait. You want to wait? Your choice. You want to lose your life? Your choice. I have no answer to this problem here. Only thing, 112 crore people, only 17 crore have been tested, 112 crore have not been tested. 18 crore you may say, okay, let us say one, give some gift to the government, 18 crores have been tested, 112 crores have not been tested. You need this number every day. 1 crore 23 lakhs per day test to reach this target. 1 crore, so much you want days, and you have to multiply your resources to 12 times. Otherwise, you forget everything. Only gratia is if 6 months you keep another one, because if you may get some vaccine, you may get some immunity. So if you say 6 times, then you have to raise. So I can say 60 lakhs per day, 60 lakhs per day to 123 lakhs per day, or 1.25 crores per day tests we require. There is no other solution in this regard, because it has happened, it's happening. Nobody can say anything on this. And then we can say how to deal with this. This is point here that we have to consider seriously. If you don't consider this point today as intellectual, as foreweaver, you know what happens. You cannot take action at 11th hour. This problem is going to happen maybe in a couple of months, but if you have to face it successfully, if you have to encounter it successfully, we have to be ready now and now. Not in coming time, but who can teach government and people of this country? People of this country, nobody can teach. You can take, for example, they have been elections and large crowd, nobody cared for COVID-19 precaution. And there have been many revolutions, national level revolutions regarding farming professions, and nobody is taking care for COVID-19 there as well. Unfortunate it is. Overconfidence always kills people. Overconfidence always mars situation. And this overconfidence shall, of course, give us negative loss, negative benefits or losses. Revolution is one part, but precaution is another part. In rallies, we don't worry. In elections, we don't care. In revolutions, we don't care. In marriages, we don't care. In gatherings, we don't care. In parties, we don't care. On road, we don't care. After all, what all this is? Have we converted ourselves to fool's paradise? This is fool's country, is it that? In a country in which crowds people are educated, and we have converted to something unbecoming. Really, it's a big setback onto us. We say we require this answer. Who can give this answer? Only testing and treatment and care. Testing and treatment and care. After discharge care. So we have to require 3 number of levels. Schedules or programs, may say plans. We require this. Who can do this? Only nation has to do it. We can only advise. Unfortunate it is that such a big infrastructure, such a wide infrastructure, government, organization, and such a wide country, such a large size country, and large volume of intellectuals, but absence of whatever requirement of plan. What to say about this? I cannot comment every day same thing again and again. We have to care for ourselves, and who shall care for us if you don't care for us? What shall I say? I have no answer. It's very tragic state today, which we are not identifying, we are not recognizing, we are laughing, we are saying why some person speaks like this. Person should not speak like that. People think that. But they forget. Facts cannot be denied. If we are able to see something, or we are able to see something offending on us, why not to have precaution applied to us? That's only point we can consider. कभी कभी गुस्सा भी आता है, कभी कभी दुख भी होता है, कभी कभी सोचते भी हैं कि आखिर क्या हो रहा है, आखिर हम क्यों मरना चाहते हैं। ये ज़रूरी नहीं कि एक्सप्रेशन में मरे कि हम मरना चाहते हैं, एक्सप्रेशन हो, कोई ज़रूरी नहीं है कि एक्सप्रेशन हो, एक इंडिकेशन होती है, एक कहते हैं टेसिट अप्रूवल होती है, चुपचाप अन्याय सहते जाइए। मैं तो कहूँगा अपने आप को क्या कहूँ, अपने आप को कोविड की तरफ धकेल रहे हैं, अपने आप को धकेल रहे हैं, अपने परिवार को धकेल रहे हैं, अपने समाज को धकेल रहे हैं कोविड को। कई केस में जानता हूँ, एक परिवार में 7 केस हुए, एक को नहीं हुआ, 7 को केस हुए, एक ने संभाला। और ये कोई नई चीज़ नहीं है, होंगे और बात से तो समझ सामने ही नहीं आ रहे, हमें पता नहीं लग रहा कि आखिर हो क्या रहा है। कभी कभी ऐसा होता है, हमें समझ नहीं आता क्या हो रहा है, और मैं समझता हूँ आज भी वही हालत है, हम समझ नहीं पा रहे क्या हो रहा है, या हम समझ कर भी अनसमझ बन रहे हैं, सोच रहे हैं सारी दुनिया में हो रहा है। यस, इसमें तो कोई झूठ नहीं है कि सारी दुनिया में हो रहा है, लेकिन हमारे यहाँ भी हो रहा है। पॉइंट ये है, सारी दुनिया में वो सब नहीं है जो हमारे पास है। हमारे पास इतनी बड़ी जनसंख्या, इतने रिसोर्सेस, इतना बड़ा देश, और मैं नहीं समझता कोई भी देश रिसोर्सेस के मामले में हमसे मुकाबला या कंपटीशन कर सकता है। नहीं हो सकता। जिस देश में बात को समझने के लिए इतने इतने बड़े पढ़े लिखे लोग हों, हर वर्ग के, इसमें इंजीनियर्स हों, प्रोफेसर्स हों, डॉक्टरेट्स हों, और हम ना समझ पाएँ, ना समझा पाएँ, या हम बोल ना पाएँ, तो मैं समझता हूँ पढ़ाई लिखाई का फ़ायदा क्या है। अगर देश एक आदमी से डर जाए कि मैं इसके सामने बोलूँगा तो मेरा ये हो जाएगा, तो फिर वो देश गुलाम नहीं तो क्या है। क्या हम गुलाम हो चुके हैं? मैं तो नहीं समझता हम गुलाम हो चुके हैं। हाँ, सोच गुलाम हो गई है, ये मैं मानता हूँ। सोच पे मिट्टी लग गई है, पानी लग गया है। सोच हमारी, जिस तरह से वायरस होता है कंप्यूटर में, मॉइस्चर चला जाता है सॉफ्टवेयर में, तो शायद उसको ख़राब कर देता है, हार्डवेयर को भी और सॉफ्टवेयर को भी। कहीं ऐसा तो नहीं कि हमारे आत्माओं में वायरस आ गया? वो कौन सा वायरस है? क्या वो कोविड-19 से भी बढ़ के वायरस है? ये तो आपको समझना चाहिए, और जितना जल्दी समझ जाए तो अच्छा होगा, हमारे लिए अच्छा होगा। नहीं तो भाई क्या कहेगा कोई इसमें, कहने को कुछ रहता भी नहीं है। क्या हम ऐसे दुनिया में पहुंच चुके हैं जहां हमारी आत्मा की शक्ति क्षीण हो चुकी है, ख़त्म हो चुकी है? आर वी साउललेस सोसाइटी, आर वी स्पिरिटलेस सोसाइटी? अरे फिर तो मैं समझता हूँ वो लोग ज़्यादा मस्ती मार रहे होंगे जो जानते भी नहीं कि उन्हें लग सकते हैं कोविड-19। लेकिन ये कब तक चलेगा भाई, कब तक चलेगा? सोचने की बात है। क्यों पिटना चाहते हो? क्योंकि हालात ऐसे होने वाले हैं, पता भी नहीं चलेगा, और अचानक समाचार आएगा कि देखिए या तो इतने करोड़ लोग गए, या उनका इलाज नहीं हो रहा। ऐसी ऐसी सिचुएशन आ सकती है जल्दी। कुछ लोगों का नशा आ गया है, मैं देख रहा हूँ। इतने वैक्सीन आ गए कि सारी दुनिया वैक्सीन मांग रही है हमसे। अरे भाई, कहाँ से सपने में रह रहे हैं आप? ये फेक न्यूज़ों को छोड़ो। पहली बात तो अभी तक ऐसा कोई वैक्सीन नहीं बना, ना बनेगा अभी तक, कि जिससे आपका इलाज हो जाए। ये वैक्सीन बन रहे हैं इलाज के नहीं बन रहे हैं। ये वैक्सीन इसलिए बन रहे हैं कि आपकी बीमारी को थोड़ा आगे कर दिया जाए। एक तरह का लॉकडाउन, जैसे कहते थे कि लॉकडाउन हो रहा है, तो ये मेडिसिन लॉकडाउन है कि आपको कुछ दिन के लिए कोविड नहीं लगने देंगे बस। लेकिन वो नहीं लगेगा ऐसा नहीं है। अभी तक कोरोना के बारे में हम कुछ नहीं जानते। 36 तरह के स्टेटमेंट आते रहते हैं, लेकिन सब काल्पनिक। रिसर्च है जी, हमने ये समझा है, हमने वो समझा है, और असलियत ये है किसी ने कुछ नहीं समझा है। सोचा था इतनी दुनिया में वैज्ञानिक हैं, डॉक्टर्स हैं, जल्दी कुछ ना कुछ समझ के बताएंगे कि इसकी जड़ ये है। लेकिन अभी तक जड़ नहीं पता लगी। जब जड़ नहीं पता लगी तो इंजेक्शन कहाँ लगेगा? सोचिए। इस भ्रम में ना रहें कि ये वैक्सीन्स आपकी सहायता कर देंगे। ये भ्रम से निकाल दीजिए। एक राजनीतिक वो इम्प्रेशन फैलाना होता है, पॉलिटिकल इम्प्रेशन सारी दुनिया में फैला रहे हैं, और कुछ लोग इस बहाने पैसा भी कमा रहे हैं। इंजेक्शन बनाओ, बेचो और नोट कमाओ। यस, ठीक है, बिजनेस है, कॉमर्स है, लेकिन जो चाहिए वो नहीं है। What actually we need, world need, is not that. It's not at all. It's only delusion that we are going to create. And when vaccine is available, people would think, I have been vaccinated, I don't need. So whatever precautions required to be adopted, that person would not take them. So it's another kind of, you can say, pathway to invite more COVID to you. और कोविड आएगा इस हिसाब से। आप वैक्सीन लगाइए, मैं ये नहीं कह रहा, लेकिन वैक्सीन लगवा के भूल जाना चाहिए कि कोविड जिंदा है, और कोविड जिंदा रहेगा, कई साल जिंदा रहेगा। आप ये देख सकते हैं, ये सेल्स क्या कह रहे हैं, 2024-2029 टेस्ट होने चाहिए, ट्रीटमेंट होना चाहिए, और डिस्चार्ज के बाद हैंडलिंग भी होनी चाहिए। इन तीनों में से 14% सक्सेस टेस्ट की हुई है, और वो भी 313 दिन में। और ट्रीटमेंट तो वही जो बीमार है उसका होगा, पैसे वाला करा लेगा, गरीब आदमी नहीं करा पाएगा। बस गरीब आदमी कहाँ से कराएगा, पैसा नहीं है। और जो डिस्चार्ज हो जाएंगे वो खुश हो जाएंगे, हम ठीक हो गए, जबकि ठीक वो भी नहीं है, ठीक कोई नहीं है। इसलिए अब समय है कि हम सीरियसली सोचें, गंभीरता से सोचें कि हम इस प्लान को कैसे आगे बढ़ाएं। टेस्टिंग के प्लान को, उसके बाद ट्रीटमेंट के प्लान को, और उसके बाद जो ठीक हो गए या चले गए, डिस्चार्ज हो गए, उनको कैसे आगे सही रखा जाए, क्योंकि उनको इन्फेक्शन के चांसेस दोबारा हैं। और जो भाई इस दुनिया को छोड़ के चले गए, उनका तो कोई क्या कर सकता है, भगवान जाने, ऊपर वाला जाने। उनकी आत्मा शांत रहे, बस इतना ही कहा जा सकता है। उनको श्रद्धांजलि दी जा सकती है, और उसके सिवाय कुछ नहीं हो सकता। तो हमारी प्राथमिकता होनी चाहिए, और हमारी प्रायोरिटी होनी चाहिए। We must have set our priorities for charting out testing scheme or plan or schedule and treatment plan and discharge handling plan. If we can do that, we will do service to our nation, and in fact not only to our nation but also to the whole world, because we are 1/6 population of the whole world. So it's our primary duty that we have to keep our nation strong, healthy, safe in every matter. That's our responsibility, and if we do that, we will do service to humanity. That's point where I say, यही मैं कहना चाहता हूँ आपसे, घबराना नहीं है। मैं ये नहीं कह रहा आप घबराइए, बिल्कुल नहीं घबराइए, संभालिए, अभी भी समय है। सरकार को भी कह रहा हूँ, अभी भी समय है, कर दीजिए 3-4 महीने में ये काम, कम से कम टेस्टिंग तो कर दीजिए, और कुछ समय में आपको ट्रीटमेंट भी करना होगा। फंड्स तो लगते हैं, आदमी मरे इससे अच्छा है फंड्स लगाइए, अच्छा है, नहीं तो मरने वाले